everybody, it's Martha Kennedy. I want to talk to you about medication administration. Now this video is going to be a little different because we all know as medication aides or nurses how we're supposed to give meds. We're supposed to check the order against the med to make sure it's the right dose, right time, right medication, right patient. But let's talk about integrity. Integrity means that I am doing it the way I was taught in school when I give meds. I'm going to the MAR, to the order, I'm getting the medication out, I'm comparing it to what is ordered by the doctor, because I am not a doctor. I pop out the pill, I take it to the resident. If the resident refuses it, I let my charge nurse know. If I'm not the charge nurse, I talk to the resident and they will talk to the resident about the reasons the medication is needed. And if it is refused, I write refuse and it will ask me to put a progress note in. Nurses, if the medication aide has somebody that refuses, you're expected to write a progress note. If you have parameters, they are written on here and you look at those parameters to make sure that you can give that medication. This is to be done at the time of administration. You cannot go back and think you know your medications by heart, because there's no way we could know all of those, and click, 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 click. That's how errors happen. Let's talk a little bit about narcotic administration. If I pull out a narcotic to give, when I pull that up on the order, I need to see that it is a narcotic. I go pull it out of the narcotic box, and we all know anytime you take anything out of the narcotic box, you sign that sheet right then. It has to be signed. You can, anytime somebody could come up, those are narcotics, they're controlled substances, and they're not to be messed around with. You could lose your license if you do it any other way, because you could have, a problem with the count. So once I've done that, they've taken the med, I come back and I'll click on PCC and I'll save. Now if you notice on here, this will show when somebody had something and it says yes or no, they got it. But we can actually run a time step to see when you gave the meds, and anybody can see that. It's called integrity. That's how you do it. So you give the meds by the doctor's order, comparing and doing all of your rights of administration. You document whenever it's given. If it's refused, you let the charge nurse, or if you're the nurse, you explain to the resident why they should take that medication. And then after they have declined informed consent, they know about it, you chart on that. You do the medications as you go and you sign them as you go. If you do it this way, your world will be so much easier and our patients will be safe. Thank you.